Hello, my name is Patricia Lango, and I'm going to show you the new way to document our suicide assessment. If we have an admission coming from the ER, we're going to go to ad hoc in our power admission form. We go to admission, transfer, and discharge to the admission history adult. And we go to CSSRS, the Columbia assessment. So you're gonna see three choices. So yes, unable to complete, and no risk assessment needed at this time. In this particular patient, we have no results. If you see documentation here, that means that the patient was already assessed in the emergency department. If that's the case, either the patient is suicidal or not. We are gonna put no risk assessment needed at this time because we're gonna do our reassessment later in both cases. When the patients are non-suicidal, it's gonna be 5 days from the day of the initial assessment. If the patients are suicidal, it's gonna be every shift, but it's gonna have to be a reassessment. So that's why we don't wanna do it right here. Let's say this patient wasn't done. So we are gonna see here no results. So we're gonna put yes. And if they say no, we're gonna answer 1, 2, and number 6. So it's gonna grade out everything. I'm gonna have left to answer. It's gonna be the number 6 question. And after the patient tells me no, that's a non-suicidal patient. So I'm gonna go here, and I'm done with the documentation of my patient. Now let's say our patient is gonna be with yes or suicidal. That's gonna take me to the key steps, the safety steps. So I'm gonna have to answer all the screens that are gonna be auto-populating by the system. The first one is gonna be the protective factors, so internal or external. So I answer whatever applies for my patient. Once I'm done, I'm gonna go here. It's like the little refresh thing. So I'm gonna push there, and it's gonna take me to the next step, which is gonna be number 3. This one is more like for the frequency, the patients have the feelings, if they can control themselves, if they think there are factors that are gonna stop them or not. So it's gonna be only one answer. You're gonna see here a little bit of a score that is gonna help us to put our patients in the risk. It's gonna help us to categorize our patient in the next screen, which is step 4. So as you can tell here, it's gonna give you some guidance to put your patient in low, moderate, or high. And we also have the score. It's gonna go from 2 to 25. So it will help you a little bit, plus what you have in the notes here in the low, moderate, and high risk. Just keep in mind the high risk patients, if they have a plan or they had an attempt, those are easy because they're high. And then the other two, you're gonna have to evaluate evaluate the patient's answers. After we're done with categorizing the patient, we go to the refresh thing, and then let's say the patient is on moderate. It's as soon as I click the risk, it's gonna open the interventions. They're very similar to the interventions that we already have, okay? So you date and you time your interventions, who you did notify, social worker, what we removed from the room, if it's applicable or not. As you can tell, in the moderate and low risk, we have optional interventions. So once I'm done with my interventions, I put my clinical note here, and I'm done. And I go back to the first step, which before didn't let me finish. So I gotta finish all this. I gotta answer all the questions. And once I'm done, even the ones here on the bottom. So everything that applies to our patient. Once I'm done, I'm gonna be ready to sign my document. So this is for the admission. It's gonna be done only once. And let's say my patient is already in the unit. So I'm gonna go to ALPHA, And like we do now, I'm gonna go to mental health. The difference is we have the frequent screener, we have the safety protocol, the one that I was showing you a little bit ago, and we have the suicide reassessment. Your patient is a suicidal patient, you're gonna document only here. It's your reassessment. So you go here, you document here, and all you have to do is complete the questions here. And you have to go to your interventions and update them, and you have to write down what happened in your shift with your patient. So you have a space for everything, things that are done, you validate them, and things that you want to update, you update them, and you can, you have here for free comments, you can document more in the bottom. I'm done with my interventions, I'm done with my questions, and I just signed the document. This is my suicidal reassessment. It's gonna be once a shift or every 12 hours. Now, your patients are high, you do not escalate your patients until the doctor says that, or if not, they're gonna go as a high risk until the day of the discharge or the day of the transfer to a facility. So now my patient is not a suicidal patient. I go to AFAC, I go to mental health, and this is the frequent screener. When they are not suicidal, it's gonna be every 5 days, and you're gonna get a task and complex care, so you don't have to worry about it. If they did the assessment in the emergency department and the patient is negative for suicidal, he denies anything, so you can put no in your shift, no, and you go to number 6, and if it says no, you're done. So the documentation is good for 5 days. Now your patient is a low risk or moderate risk, and now they're saying that they have a plan, that they gotten words. It's not gonna happen very often, but then you have this protocol where you can do like a complete assessment again, so you can escalate your patient. Remember, you do not de-escalate, but you escalate up. So in order to provide that patient with the high-risk interventions. Okay, and please let me know if you have any questions. Thank you.